So the next question we want to answer for our listeners and viewers out there is, what is medical detox?
Well, the difference between just detoxing on your own or going into treatment without a detox is you simply stop taking the drug. And so that's just detox. A medical detox is that you're seen by a physician who, depending on what your drug screen shows, what drug you've been on, has a protocol that addresses all of the symptoms that may occur as a result of the drug leaving your system. So let's say it's heroin. There are set things that happen. You get sick, you get restless leg syndrome, your muscles ache, you can have a fever, you can have diarrhea, you can have nauseousness. All of those symptoms will begin occurring simultaneously. And one of the reasons why it's hard to get off of opiates is because of all those symptoms. You're so sick and you're sweating. So that can become a medical risk because you've been taking something that has slowed down your respiratory system and suddenly it's pulled from your system and the heart rate can increase, the blood pressure can go up, and there's a risk of seizure or stroke. So all of those, your vital signs, all of that needs to be monitored every 4 hours. And the protocols, and by protocol I mean it's the prescriptions or the drugs that are used for a set addiction. So like the protocol for opiate would be different than the protocol for alcohol, because the symptoms that usually occur with alcohol are a little bit different. With opiates you have more achiness, more violent pains. One of the side effects of the opiate use is that your brain actually begins to mimic pain. So going back to the pill addiction, I'll have people come in that started on a very legitimate pain pill med, and by the time they come see me 2 or 3 years later, that has increased and increased and they can't stop hurting. So all of the symptoms created by the drug leaving their system are addressed medically and need to be for the safety of the client.
Sure. So when you're talking about medical detox, it means that they're directly in contact and being seen by a medical professional,
yes,
a physician, a medical doctor that's going to see them through the detox professionally with a set protocol for that type of addiction.
Absolutely. And if they get into acute distress, we're aware of that immediately, so they're taken to a hospital where they can be monitored 24/7. Most treatment centers do not do acute medical detox. Those are people that have already gotten into the OD phase or are unconscious or things like that.
Okay.